Welcome back to another explainer. Today, we're diving into a daily health report that's fascinating, occasionally a little weird, but absolutely crucial. And it's literally sitting right there in your toilet bowl. We usually just flush it away without a second thought, right? But your body is actually giving you real-time, personalized data on your internal health every single day. So let's break down the entire color spectrum of urine and decode exactly what your system is trying to tell you. So, is clear pee actually the healthiest? Let's shatter a massive myth right off the bat. Most people look down at the bowl and think that a perfectly clear, transparent liquid is the ultimate health win. We've been totally conditioned to believe that more water equals better health, but is crystal clear really the goal? Well, surprise, it actually means you're drinking way more water than your kidneys even need. When you overdo it, your kidneys are essentially just flushing that excess water straight through without concentrating it. Now, mild overhydration, not really a big deal. But in extreme cases, think marathon runners or folks chugging gallons of water a day for a new diet, it can actually dilute your blood sodium levels. That leads to a dangerous, sometimes life-threatening condition called hyponatremia. And that can trigger confusion, seizures, and in super rare cases, even death. Crazy, right? Okay, so this brings us to your true hydration baseline. Notice how pale yellow is what doctors actually want to see? That is the literal textbook definition of normal. Dark yellow, usually just a gentle nudge to drink a little more water, and it's totally expected first thing in the morning when you haven't had a sip of anything for 8 hours. But consider that last stage, amber. That right there is a mandatory checkpoint. If you're seeing amber, your blood volume is dropping, your heart rate is creeping up, and you need to hydrate immediately. Not later, right now. Now, you might be wondering, why yellow in the first place? Well, the science behind your normal baseline all comes down to a magic number. 120 days. That is exactly how long every single red blood cell in your body lives before it reaches the end of the line and gets recycled by your system. And part of that incredible 120-day recycling process ends up right in your bladder. It becomes a yellow pigment called urochrome. So, when your hydration and your urochrome output are in perfect harmony, you get that ideal pale yellow. If you're a bit dehydrated, you still have the exact same amount of urochrome. It's just packed into less water, so the color naturally deepens. It's basically a perfect visual gauge of your internal concentration. Moving on to our next category, the harmless diet deceivers. Let's talk about orange. The crucial thing here is contrasting harmless dietary quirks with actual medical red flags. Eating a ton of beta-carotene, like a massive plate of carrots, or taking common UTI pain meds like phenazopridine can totally turn things bright orange. No big deal. But orange can also mean bilirubin is spilling over. That's a pigment normally processed by your liver. If you see orange paired with pale, clay-colored stool, that is a genuine liver or bile duct red flag. You definitely need a doctor for that one. Now, pink or red. This one definitely alarms people the most, and honestly, rightfully so, since blood is a common cause. But before you hit the panic button, remember that eating beets, taking certain laxatives, or some chemo drugs can cause a completely painless red tint. Seriously, depending on your gut bacteria, a beet salad can just pass right through harmlessly. The real dividing line here is pain and time. Painless red that happens just once? Probably diet. But red paired with pain, or a red tint that sticks around for more than a day? Skip the Google search and call your doctor. Okay, blue or green? I know, it sounds completely fictional, like something straight out of a sci-fi movie. But there is actual science behind this. Certain antidepressants and anesthetics can tint things blue or green as a totally harmless side effect. There's also an extremely rare genetic condition in infants known as blue diaper syndrome, where a defect in absorbing the amino acid tryptophan literally turns their diapers blue. And finally, some specific hospital-acquired UTIs caused by Pseudomonas bacteria can produce a blue-green pigment called pyocyanin. Almost never dangerous on its own, but man, wildly strange to see. All right, let's shift gears from the harmless stuff over to the medical red flags. If things are looking brown or cola-colored, please do not take a wait-and-see approach. Sure, this could point to severe dehydration or jaundice, causing a massive bilirubin buildup, but it can also signal something much more dramatic called rhabdomyolysis. It's a mouthful, but basically it's extreme muscle breakdown. It usually happens after crushing injuries or unbelievably intense, extreme workouts. It floods your bloodstream with a muscle protein called myoglobin, turning things the exact color of dark tea. If you leave that untreated, it can cause total kidney failure. What if the color is fine, but the consistency is, well, cloudy or milky white? You're usually looking at one of a few key culprits.
A run-of-the-mill UTI introducing white blood cells and bacteria is the most common, especially if it burns. Kidney stones releasing tiny crystals can do it too. Less commonly, it's excess protein or fat from kidney dysfunction. Oh, and get this, in rare cases of tropical parasitic infections, a condition called chyluria can actually cause lymphatic fluid to leak directly into the urinary tract. Next up is foamy urine. Now let's be clear, a little bit of foam that vanishes in a few seconds is totally normal. It's just air mixing with water from a strong stream. The danger is when it persists. If you have thick, bubbly foam that just sits there meal after meal, day after day, that means your kidney's filter system is failing. And that leads to a dangerous leak of protein directly into your system, known as proteinuria.
That dangerous protein leak happens because of a failure in your nephrons. Think of nephrons as millions of microscopic filtering units inside your kidneys. When they get damaged and stop screening out proteins the way they're supposed to, it causes that persistent foam we just talked about. Spotting this foam is absolutely critical because it's often one of the earliest detectable signs of chronic kidney disease. We're talking years before any other physical symptoms even show up.
Finally, let's explore our last category, the rare and bizarre anomalies. So, considering everything we've just covered, can it actually be purple? I mean, is that even biologically possible?
Believe it or not, yes, but under very, very specific conditions. It's aptly named purple urine bag syndrome. It happens almost exclusively in patients relying on long-term urinary catheters. What happens is certain bacteria break down that amino acid tryptophan into unique compounds that slowly turn the plastic collection bag a shocking violet blue. It looks absolutely terrifying, but surprisingly, it's typically just a marker of bacterial overgrowth rather than a sudden emergency. Though, yeah, it definitely still calls for antibiotics.
And at the absolute bottom of the color spectrum is black. This is a color your body should almost never produce. When it does, it's a huge red flag for serious underlying issues. It could be alkaptonuria, a rare genetic defect where your body can't break down certain amino acids, turning things black the second it hits the air. Other documented causes include heavy metal exposure, a few obscure medications, and in super rare instances, advanced melanoma.
So as we've learned today, the healthiest baseline actually isn't clear at all. It's that perfect pale yellow. We journeyed through the ideal balance all the way to the absolute rarest shades of blue and black. The next time you go, remember that your body is handing you a highly detailed, completely free daily health report. The clues to your hydration, your diet, and even your kidney and liver function are literally right there in front of you. So here's the real question. Next time you flush, are you actually going to pay attention to what your body is trying to tell you? Keep an eye out, stay hydrated, and we'll see you in the next explainer.